Okay, so I'm going to keep going on with tutorials. This will be now the tutorial number 10 related to patient's file, and I just want to make a very short one which is following the number 9. You remember I show you how to enter a new patient data, and let's say that this patient data which I entered last time, you remember the name was Demo and first name ONDB. So we're going to find this guy now, and let's say that today I've operated the opposite ear and I need to enter the same thing as I did for the first ear. So I will operate the right ear and then I will enter now the data, clinical, surgical and audiometric data for the other ear. So we need to find out the same patient. So you remember we have the way to determine the patient. You can click to list of patient, but you can also click to search, and shortcut will be Apple New. But let's say we click to search like this, and then we have to enter the name, which was Demo, and then first name was ONDB. All right, enter, and now you see we have two because I created two different types, but let's go back to the one I created before, which is this one. And now we find exactly what I entered before. So this patient, you remember, was operated on his left ear during August 20th, 2020, so very soon, and I'm going to operate now the right ear. So if you go back to the left ear again, you can see exactly what you have done with all clinical, surgical items and ossicular reconstruction items that we have already entered. And we can also have access to the pre-op audio, which was already entered, and the last post-op. So today, let's say that this is now, let's say 6 months later or 1 year later. So this is going to be August 2021. So let's go back and now enter, well, let's say I'm going to operate this patient in February 2021. Usually I wait at least 6 months, 1 year, but for the demo, let's say we're going to make it short. So I've operated this patient today, which is February the 3rd, 2021. So now we are going to enter the right side. So I'm going to click to plus. You can see the green plus here. So I'm going to click there. And of course, I'm going to select otosclerosis and then primary surgery and then the right ear. And now again, this is going to open another patient file for the opposite ear. So we're going to do it very, very quick. So bilateral progressive. And now we have a tympanic membrane, which is normal. Now the external auditory canal also has some exostosis, just like the first side. Now if we click to surgery, surgeon was myself again, so I click on my name, and then stapedotomy was the same as usual, stapedotomy with interposition, laser, and drilling stapedotomy simultaneous techniques. And then, well, I didn't find, that was a type of otosclerosis. Again, that was, you remember, I entered obliterative otosclerosis. Let's say that in that case, on the opposite ear, we had the basic anterior focus. And then I didn't have any associated pathology. Remember that for the first side, I found a malleus incus ankylosis and I had to perform a malleus to stapedotomy procedure. But let's say that for this side, we just had a normal situation without any other associated pathology. So it's going to be like this. With type of laser was, as usual, the CO2 luminis with autolas. But again, if you have a new one, you remember, you can click like this to other in this field. And then you enter a name of the new laser. Now, interposition will be vein graft. So I created on vein graft, and mucosa was normal. Okay, same as the opposite ear. And now I click to tab ossiculoplasty, tab number 4. type of prosthesis was a basic cast Teflon piston, but you have a list of that. If you have a new one that you just start using today, you can again click to other like this, and then this will and then you can enter the name of the new prosthesis. But let's say that was the, I have to find out the 0.4 millimeter Teflon piston like this. I validate, and then position of the prosthesis will be incus to stapedidotomy, of course. And I have to enter the prosthesis length, which you remember is mandatory. Remember I explained that each time we have a red dot like this, it means that it's a mandatory item and you cannot save the file unless you have entered at least one item. And you remember that if we have a cross, it means that it can be a multiple choice item, which is not the case here. So prosthesis length, let's say for example 4.5, and that's it. I didn't have to enter anything else. So we are now we need to change of course the date, because otherwise there will be a problem with the patient file. So we said that we are now operating this patient 2021. There we go, and now I can save the file. So here we go. Now the pathology file for the right ear has been completely entered. So I mean we can save it now. So I can click to save, and now definitely we can see for the same patient we have now the left ear, which was operated in 2020, and the right ear in 2021. However, now we need to enter the audiometry, pre-op audiometry of the right side. You remember if I click to the left side, I have the audiometry pre and post-op only for the left one. For the right one, at the moment, we don't have any audiometry because I need to enter the pre-operative audiometry. But let's say that if you have done the audiometry today, and in fact you found that that was exactly the same as the one you made in February, 1 month later, 1 month before, so you can duplicate this one to put it to the right ear to be sure that you are not making any mistake. The other option would be, of course, that you create by clicking, as I explained to you before, to the green cross, and then you open up the audiometric file like this, of course, and now you need to change the date, otherwise it's not going to work. So that's going to be same date as the operation, for example, which is March the 9th, and then you can enter this field like we did. But let's say you can like I did before, I show you how to enter these different frequencies by clicking on the box like this. You remember that? But let's say that there's another way to do it, which is even faster. But of course, it needs to be the same audiometry as the last one you made, February the 3rd. So what you do is you can say you go to left and you want to duplicate this one for the pre-op of the right ear. So you just first select the left one, the left ear, and then you go to the last one, which was made in February, and then you can see by clicking on that you have a new windows coming up here called duplicate audio file. So if you click there, then you have a new window which is opening and saying caution, you will duplicate audiometric file. Of course you said yes, okay, and now you need to select the surgery you want to duplicate the audiometric file, audiometric test for. So I want to duplicate the last post-operative left ear audiometry to the pre-op right ear audiometry. So I say okay, and then now I need to select the right, and then of course I need to change the date, because the date will be same. If you do it regularly, you don't have to change that because the program will automatically recognize the clear date. But because I changed and I made some modification, I had to re-enter the date. So I click now to validate, and what you can see, we have duplicate exactly the same audiometric file as the one which was done before. And if you want to change something, you have duplicate this one, and then you discover that that's not exactly the right one, so you can change the thing. So for example, let's say that the right ear deteriorate a little bit more, so you can click on air conduction like this, and then you can change the audiometric file like this, and let's say that the left ear was better, closure, like this, and then you save. So now we have, but of course you need to change the date. So now we have the left ear and the right ear, and that's going to be the same. Now you're going to enter a post-op for the right ear, and you will have to duplicate the post-op of a right ear for the post-op of the left ear. So let's say now I see this patient in December, so December 2021, and now I'm going to enter this patient audiometric file like this. For the right ear, this is the post-op of the right ear. So let's say we have completely closed the airborne gap, and you remember that because it is a post-operative audiometric file of a right ear, we have to also enter now clinical items about the complication. Let's say I don't have any complications, so that's fine. What is going on with the ossiculoplasty? Let's say that it was stable and well tolerated. Tympanic membrane was now normal. So this is fine for the post-operative right ear. You can see right, and now we have this file, December the 1st, 2021. So now I want to duplicate this one, exactly the same, just to be sure that we are not going to make any mistake. I will duplicate this post-operative right ear audiometric file to the post-operative left ear audiometric file for the same date. So I select first right, then I click on this one, duplicate, okay, left, and then you need to change the date. Again, if you do it regularly, you don't have to do that because the system will automatically recognize the date and put the same date as when you're doing. But I'm tricking, of course, so I need to change those things. There we go. And now for the left ear, we create exactly the same post-operative as for the opposite ear. This is the system that I wanted to make for this program to make sure that we are copying the same audiometric file for both sides at the same date, of course. So we have to do the same complication, known, and then ossiculoplasty was stable and well tolerated, and then tympanic membrane was also normal. All right, and now we can save the file, and now again you can see for the same patient, Mr. Demo ONDB, we have operated the left ear in 2020 and the right ear in 2021. We have everything we need, pre and post-op hearing test for the same date for the left ear, and pre and post-op audiometric test for the right ear, same date. So I mean the file is completely made, and I think it's a nice way to enter patient's file and audiometric file. The way to duplicate the audiometric file helps the surgeon to enter the same audiometric for both sides at the same time. So thank you very much for watching. I will demonstrate with the next tutorial how to change the preferences, including the different frequencies that have been chosen and decided to calculate for calculation and selecting audiometric file. And also the last one, the last tutorial, will demonstrate how to completely customize this database for any type of pathology, any type of specialty, especially in the ENT field for thyroid surgery, for example, but also you can make it for pneumology or any other type of specialty. I will demonstrate that later. So thanks very much again for watching.